So a sometimes tricky question for students to answer is, how do we figure out if we're looking at the bottom or the top of the rib? And by that I mean superior or inferior view. It's a little easier when we have this context, but what if you had a rib by itself that wasn't articulated with the thoracic vertebrae? In that case, you're going to want to use an important landmark of the rib, which is this costal groove. So the costal groove is best viewed inferiorly, and what I do is I will actually pinch that costal groove. This is how I know that I'm looking at the inferior view of the rib. Once I figure that out, I flip it. So I know this is the underside. Let's flip it. And now let's think about where the vertebrae would be connecting. This is that sternal end that's more flat. This is the end with the head and the tubercle that are going to be articulating with our vertebrae. So I imagine the vertebrae is here, and we can use an actual vertebrae in this case just for visualization. So I'm picturing this vertebrae here. The body is anterior, the spinous process is inferior. This is how the rib's going to line up, and based on that, we know that this is a left rib. So let's try that process on the other side with a different rib. So again, we're given a rib like this, no context. Let's go ahead and find that inferior costal groove. Okay, so it's right here. Got a nice ridge of that sharper tissue. So I'm going to pinch that costal groove. Let's flip it now. So this was our inferior view. This is going to be that superior view looking down on the rib. And then let's find our end. So this is sternal end. This is our thoracic or vertebral end. Okay, so the vertebrae is going to be sitting here. Vertebrae is going to be sitting here pointing that way. So this would be the body over here, spinous process here. These are dummy vertebrae just to help visualize. Okay, so based on this, this would be a right rib. So when you're trying to identify these, always try to find that costal groove first so you know your inferior versus superior view. Flip it to our normal view, and then figure out which side is going to have the vertebrae and which side is going to be sternal. And from there you can figure out your left versus your right ribs.